Hi, my name is Kaylee Cox, and I will be presenting within this video conference about the infectious agent Ebola. So what is Ebola? Ebola is an animal-borne zoonotic pathogen. Scientists believe that people are initially affected with the Ebola virus through contact with an infected animal. They have done studies and they have seen that fruit bats or non-human primates are one of the causes. This is also called a spillover event. And then this virus can spread from person to person, potentially affecting a large number of people. And we first discovered this disease in 1976 near the Ebola River. This infection comes from a group of viruses within the genus Ebola virus. There are 6 known species of this virus, but only 4 are known to cause disease in people. It is affecting people and non-human primates by severe inflammation, tissue damage, and hemorrhagic fever virus, and then it also has caused clotting issues within the body system, and then this can lead to internal bleeding. Case fatality rate is around 50%, but has varied from 25 to 90 in past outbreaks. So how does Ebola spread? Like most viruses, it is spread through broken skin or mucous membranes in the eyes, nose, or mouth, with blood or bodily fluids. This is from urine, sweat, feces, vomit, breast milk, and semen of a person who is sick with Ebola or has died from this virus. Contaminated objects with bodily fluids, such as clothes, bedding, needles, and medical equipment. And then, as I said previously, affected animals, and then semen from a man who has recovered from Ebola through oral, vaginal, or anal sex. And then the virus can remain in certain bodily fluids of a patient who has recovered from Ebola, even though they have no symptoms. So who's at the highest risk? We are looking at healthcare workers because they are frequently being infected while treating patients who are suspected to have Ebola. This occurs because of close contact with the patient, and then when infection control precautions are not strictly practiced, and then healthcare workers that do not have the proper PPE or don't take off the PPE correctly. And then family and friends are in close contact with Ebola patients are also at high risk because within burial ceremonies, they for those that are deceased, they involve direct contact with the body, so it can contribute to transmission. And then pregnant women and children, and then low risk are travelers and general public. So signs and symptoms. So the incubation period is 2 to 21 days after exposure. The average time is between 8 to 10 days. The symptoms of Ebola develop over several days and become progressively more severe. It usually starts out with dry symptoms such as fever, aches, and pains, and then progresses to wet symptoms such as diarrhea and vomiting. Many cases are typically seen or as influenza, malaria, or typhoid until it gets serious, and then you see different stages of the symptoms when it's late cases like red eyes, hiccups, and skin rashes. So testing and treatment. If the patient is showing signs, then you need to get blood samples and needs to be tested to confirm infection. There's the PCR test, and then detection of antibodies, and then we have seen an increased or highlight of supportive care to the key of survival, like support rehydration, using other medications to help with other symptoms, and treating infections. Medications can help lower blood pressure and fever. And then the two treatments approved by the FDA are Amenzib and then Ebanga. I'm probably pronouncing these wrong, but they were approved in 2020 by the FDA. So the importance of understanding Ebola has brought light to providing adequate training for medical staff, increase infection control measures, and provide adequate education to general public. And then prevention, we want to reduce the risk of wildlife-human transmission, human-to-human transmission, and then outbreak containment measures, and then reduce the risk of possible sexual transmission, and then reduce the risk of transmission from pregnancy-related fluids and tissue, and then also have proper PPE on and off, and then vaccinations that have been approved by the FDA in 2020 for those who are 18 years or older. This vaccination is called Ervbo, and it protects the Zaire Ebola virus. Alrighty, thank you for taking time to be here. And then if you have any questions, you can contact me, and here are my resources. Thanks.